And Catherine, would you like to introduce yourself as well?
Hi, I'm Catherine. I'm from the CCG and I'm very excited about today.
Thank you. So I'd like to start off by just recapping what the issue was that we discussed from our last meeting. So we wanted to focus on how we can better the access to mental health services. I believe an email was sent to you earlier today, Catherine, about our main focuses. Do you have any feedback before we go into more detail?
I might avoid putting myself on and off mute if I'm Zoom mute a bit funny. No, it was really useful to hear, and yeah, very intrigued to kind of just explore some of the main points a little bit more, and just some of the sort of thoughts. So yeah, no, it was really good to have that structure. So thank you. That was useful to have that beforehand. Thank you.
Thank you. So our aim today is to make sure that we decide on two of our issues, our resolutions for the issues, sorry, to decide on two of them, and we're going to go forth with those two issues and have another meeting in a few weeks' time about how we can, carry on. So we're going to go through our main focus, what the current issues that we currently face with these focuses, and how we're going to improve on this. And we will be talking about the website Keep Your Head, which you asked us to have a look at as well. But first, I'd like to talk about a delegates meeting that we had a few weeks ago. We listened to over 1,500 people from 12 diverse organisations across the city. And during this meeting, we talked about the two main issues that we currently face in Peterborough. The first one happened to be safety and crime, and the second one is mental health. And I think that despite coming out of lockdown in a couple of weeks, mental health will still continue to be a massive issue that we face in Peterborough. And I'm going to go on now to Ostea, who's going to give some statistics and an overview of the current situation that we have.
Thank you. First, I would like to bring back some of the important statistics from our last meeting together. The Cambridgeshire Peterborough CCG is one of the largest in the country, comprising 86 GP practices, serving a patient population of 998,000. It has an annual budget of 1.3 billion, which works out at just over 1,000 per person. When trying to achieve our goal, we are aware that we will have to stay in the budgets of the NHS. It is one of the least well-funded in England, receiving less per person funding than neighbouring CCGs. NHS digital data shows that in 2019 to 2020, 9,190 under-18s were referred to mental health services across the area covered by the NHS Cambridgeshire and Peterborough Clinical Services Commission Group. This was a 62% increase from the year before, which could only mean the number of under-18s who haven't been referred or have been able to access help has also increased. 3,510 children saw their referrals get closed before they got treatment. These are numbers we have access to. However, we do not know how many children haven't been able to even find a way to access help. We need to make access easier to find and understand so that young people do not become overwhelmed and deterred. The issues we found in accessing mental health services are as follows. 1, emergency access to mental health. 2, lack of education. 3, initial assessment. And 4, waiting times.
Thank you, Ostea. So, sorry, now we're going to go on to Phoebe, who's going to talk about the current situation, specifically about 3 of our main issues. So the initial assessment stage, emergency access to mental health, as well as under advertisement of services that we have. Thank you, Phoebe.
In the current COVID climate, young people's access to help is extremely limited and often hard to find, despite there being many services out there. Young people can contact their GP to have a short conversation in order to determine whether they will need further support and what the most beneficial type of support would be. However, this is a hard task to achieve in such a brief conversation. Some young people will not even know to contact their GP and will try to self-refer themselves or reach out to their schools, who are limited in what services they can offer. With many of the services available to young people being hard to find and difficult to fully understand, young people are left feeling alone and confused, not knowing where to get the help they need. On such services, CHUMS, a nationwide mental health charity that provides help online in the form of workshops, messages and calls, video and voice. While this charity offers many young people a good start to finding the right support, it is not well advertised to young people. In fact, when searching for the CHUMS website, the top search result is a clothing website as opposed to a mental health service. There is a good service and first support system that is accessible across the entire country out there, yet it is so under-advertised that a barely known European clothing shop is the first search result. After doing some research, CHUMS, the clothing shop, has around 1 million customers, and 1 in 6 young people are struggling with mental health issues. This really demonstrates how unknown this promising mental health service is, so those in need do not go searching for it. In addition to this, the services available through the NHS are also under-advertised. When searching for support through the NHS, there are a number of search results that are all relevant to mental health services that can become quite overwhelming for young people. This is only emphasised when you go onto the homepage and select services. There are so many services available that are listed A to Z. For a young person who may have been feeling afraid and unsure of what they're going through, it can be so overwhelming and deter them from finding the help they need. After having found the mental health service that the young person wants to access, there is the daunting task of the initial application process. Sometimes this is a long, exhaustive form, other times it can be done face to face. Considering the fact that reaching out for help in itself is a terrifying task, the process of doing it should be as accessible and approachable as possible. Both processes are very intimidating to somebody wanting help and can deter them from completing the application process. When searching for immediate help, you are shown only a few hotline websites, and the rest are general advice about maintaining positive mental health. The few websites that actually offer immediate responses each contain multiple different options for assistance. Additionally, when you click on the NHS website, there are so many options to call or text for immediate help. This is once again a daunting and overwhelming choice, so much so that a young person might not call at all. We need two options, a number for a suicide crisis and a number for immediate reassurance response. This will make it less overwhelming and easier to get in contact with somebody. A young person searching for a form of mental health support can become overwhelmed by the amount of services and support systems available. While it is good that there are so many services such as the Samaritans and Shout, especially once tailored to specific struggles such as eating disorders or personality disorders, this young person may not yet know what struggle they are facing and may not know which of the many services to use.
Thank you, Phoebe. Catherine, do you have anything to say? Did anything stand out to you about what Phoebe said there?
Well, firstly, thank you. That was very, very useful and very interesting. And actually, I think, you know, the one thing I kept picking up was around advertising, and I think that is something as a commissioner we've had many a conversation about how do we reach out to young people, and that's why when I was first invited to meet with yourselves, and you offered that you wanted to engage in the process. Actually, I think what in my role, actually, how do we engage with young people? How do we get information out to young people? Because there are lots of people who sit in my kind of world who we're not perhaps au fait with the social media world. We're not young people, and therefore actually being able to speak to you and have those conversations about the better way to do that. I think that was also about the emergency number. So there was a big, so across Cambridgeshire and Peterborough, we've had the first response service, which is your NHS 111 option 2, which is now been rolled out nationally. But it's very interesting that when you've been and looked for it, that you can't find that number, and that should be the number that you go to in that crisis. If you're feeling suicidal and you're feeling at that point of you really need help. And that is a national, so it's something we started locally. We were one of the pilot sites, but it is a national drive as well. So it's interesting that you've not been able to find that. So we have a crisis steering group, and I'll take that back to them to see what the feedback is around that. I think my thoughts are probably a lot of that work was done with adults rather than young people. So maybe some of the key words. I think it was really interesting what you said about things not coming to the top when you search, because I know when we first put in Keep Your Head, I think there's a song called Keep Your Head. So when you first used to put it in, our website used to come up really low, and then we had to do, and I'm afraid I'm really not very technical, so I don't know but do something or other that made, when you put it in, it came further up, because again, very much we're aware of that. But I've always thought, unless you know Keep Your Head is the website, how will you know to go to that? Although it pops up now first, if you don't know what it's called, how do you know? You don't know what you don't know. So from my perspective, it'd be really helpful to understand and think about how we can get that information out there better, how we can advertise, where we advertise, how we do it, the wording we use, the things that we look for as a young person that would make you think, actually, that's where I need to go, that's what I need. And also the other point was, I think about, you don't necessarily know I don't use the word wrong, but what your concern is. So you don't know whether to go to somewhere about anxiety, somewhere about low mood. It's quite medical, a lot of our terminology, and we have spoken about that and acknowledged that. And again, it's how can we do it? What language can we use to help young people like yourselves think about and find information in a more accessible way, because it is, if you look at the NHS Choices website, which is a nationally defined website, it's very much in terms of medical terminology, and so that's why I wanted, to help you to help me with the Keep Your Head website. How can we make that more user friendly, so you know where to go for things? What words do we need to use? How do we structure that actually you get to the right place? Because that's the main aim. Whatever your issue might be, we need you to be able to get that information. It is a complicated picture. I work in it all the time, and it is complicated, but how do we break that down? How do we practically do that? And that's what I'm really hoping, that as we work together, we can work through and work out how to do it. It's not going to be perfect first time, but I think we can do it.
Thank you, Catherine. We're now going to break down some of the issues that Phoebe talked about. So we're going to start off with the initial assessment, which will be talked about by Tonya. I think the initial assessment will cover this idea of how we can make things more friendly, how we can make people more comfortable. So Tonya?
Thank you, Becky. Now that the young person has found the service they're looking for, the next biggest deterrent they face is the initial assessment. This process is often long and relatively hard to fill out, as one of our speakers has previously mentioned. Given that this initial assessment stage is, for some people, the first time they will openly explore and talk about what they're struggling with, what we need is something that is able to cover all the mental health struggles to help find their diagnosis, but in a simpler way than what it is now, so that young people do not feel forced to categorize how they're feeling to sometimes or every day. There could also be a variety of ways in which to gain this initial assessment, from a telephone call to a paper form. Different people will find it less stressful to undertake this assessment in the way that suits them most. From personal experience, I can add that having a one-to-one conversation on the phone works better with me than just filling out a form, as it gives me confidence and self-esteem to transmit my emotions verbally with accuracy across to the recipient, as there is actually someone on the other line actively listening. However, once again, it all comes down to the individual's mentality and the situation that they're in. So we had a couple questions. The first one was, how could we make a specific sanctuary for the young people where they can open up about their situation with a professional?
What sort of, when you talk about sanctuary? Sorry, Karen.
So we know that there is a source called the Sanctuary for adults to be able to access mental health assessments. We're just wondering if there's somewhere more approachable like that, or whether we could sort of like set up something like that for younger people too, just to make it a lot more accessible.
Okay, so the sanctuary that the adult sanctuary that you're talking about, so that's for those who are in sort of in a crisis moment, and it is that kind of safe place, that place to go, and it's for 16 years and above. So is it about having somewhere where you're in crisis, or I use the word crisis, but actually that means different things to different people, so it's probably not the best terminology. Is it about having somewhere, sort of almost a safe place to go to have that conversation when you're not feeling well?
Yes, definitely.
That's the thing. Okay, so it's not something that we've really looked at, I have to say. So the sanctuary as we have is for 16 plus. What we have talked about, and it's something we could explore and consider, is around having almost like a telephone line. But I then also hear what you're saying about it's around that choice about where you go and how you access, and I think that does become a bit of a challenge in terms of having something for everyone. So is it about, and I suppose one of the things we've also thought about is where schools fit into that, and I guess it's where we put it, because one of the the challenges around when we did the sanctuaries, we had it in two. Cambridge and Peterborough is a really big geography, and building a place is quite difficult when you're trying to find different places. And I know you're talking about Peterborough because that's where you live and where your focus is. But you know, from a CCG perspective, we have to think across Cambridgeshire and Peterborough because that's where our remit is, across Cambridge and Peterborough. So I think it's something to think about, but I think it's around what is it that we want it to do, and how, you know, around that choice around whether it be face to face and where would you put it, some of those practicalities. So I wonder whether, I don't know about, and do different schools have different places like that, you know, that provide that, or is it something separate to schools? I suppose it's some.
I know that my school, King's, we don't have a dedicated mental health room as such, but we do have places where we can go if we do need to kind of take a breather or get out. However, that's not always accessible in like a discreet manner. So I know that for a lot of students in my school, it's quite difficult to access mental health without it being obvious. And I know there's just so much stigma around mental health that they don't feel able. So could we come up with like a crisis response for schools across Peterborough, somewhere where teachers can like signpost for students to go and receive help?
Okay, I mean, it's something we can certainly think about and how that fits in. So we're doing a remodelling piece of work around some of our services. And I suppose that's the thing about that access and that choice. I think that's quite a key part of that. It's a bit difficult. I can't at the moment so it's a new piece of work and we haven't sort of formally launched it, so we haven't got a statement. So once we've got a statement around what that will look like, I can bring it more, but we're just currently working through that at the moment. So but that's something certainly we can feed into that around how do we get that safe place. So this is just an example from head. So say like if there was somewhere like a drop-in type place in a library or a public place that you could access at a set time. I think it would be challenging to have something that's open all the time, but it might be if, you know, if it was say open on a Tuesday and a Thursday afternoon for a set period of time, you knew that you could go there at that point. Is it that sort of thing that you think would be quite helpful?
I say that would be quite helpful. However, I do think that we need to have, this is my point actually, like a crisis hotline, like a short crisis hotline for people to access. Because like we know we have like 999 for physical illness, but a short, easy number for mental illness, I think would be quite required, because there are those certain times where you would be able to go. However, many people have crises when it's not in the time where they can access that help in person. So we know that the NHS has launched a mental health ambulance for a trial period. So maybe we could coincide that number along with that. So that could kind of help ease the pressure on the ambulance service in general, really, if there were special mental health ambulances for people who are in crisis, and then you've got people in physical health crisis, you'd be able to essentially treat people more efficiently.
Yeah, so we have the NHS 111 option 2, which is that number, but I think it again comes back to the point that was made by Phoebe about not knowing about these numbers, and that's very much about those who are at immediate crisis. And I guess it's around, is it almost, I think the word crisis is quite a difficult word because it means different people. So actually, you might not be in a medical mental health crisis, but actually you're at a point you just need someone to speak to. You need to kind of have that engagement with someone to listen to you. Yeah. So in that case, actually, it might not meet the kind of criteria for the first response service, the NHS 111 option 2, but actually you still need to speak to somebody quite urgently.
Yeah, would it be all right if I read you a testimony? I just kind of want to explain how 999 and 111 isn't always the best option. Yeah. So here it is. My friend was suicidal, so they reached out to me. We called 999 and they suggested that we come into the local hospital. When we got there, we were put into a waiting room and told to call 111. It wasn't a physical illness, so it didn't seem to matter to them. My friend, being distressed, couldn't understand what the first responder was saying, and it didn't help that they had to wait from 10 at night to 9 in the morning to receive help. They were tired and ill, yet we were told to wait in a room with no support or even a bed to rest in. I wasn't trained in a way to help them or safeguard my own feelings. I'm angry this hasn't been resolved sooner. I know of others who have reached out for help, but it hasn't been taken seriously enough because they didn't want to commit suicide. I just kind of would like to point out that using like the current NHS emergency numbers, I don't think it always works efficiently. And so I just feel like if there was a dedicated line, situations like these could be prevented, and that actually that person could receive immediate help, because if this person wasn't there, then they could have killed themselves, really.
Yeah, I hear what you're saying. And I think we just need to think about how it would link up, because I think we also need to think about
Definitely.
how we don't have too many things as well to make it even more complicated.
Yeah.
But certainly, you know, if there's issues around, and I think there's definitely a need, and we have acknowledged that in commissioning world, about the need to link up the knowledge and between physical health, so between, you know, going in somewhere like A&E for physical health, but actually in mental health, and knowing where to go and what the information is and how to support people.
Yeah.
I mean, I haven't got a resolution now, but I mean, it's certainly something we can look at. But I think we also have to be mindful that we have got that, and it's just, is it about that we need something new, or is it about that we just need to get services to know more about it so that they link it up? And then there's that communication. What you were just saying there, to me, it very much sounds as well like it's about having that conversation and not just leaving somebody in the room to get on with it. Actually, how do you support somebody during that? So there's a training element there to people who are working in physical health settings about mental health.
Do you think we could work on having a crisis response for young people in A&E? Because I know this person, obviously there weren't any mental health professionals around, so they weren't able to receive help. I definitely think that's something that needs to be addressed and changed.
We certainly can have those conversations and look at. Yeah, we can certainly look at it. What we can do, I think we just need to be, we can have a look at that and see how that all links up. Definitely.
Thank you.
Okay. Thank you, Emma. Some really good points and a really lovely discussion there. It's definitely a very big issue, access to mental health, both the initial assessment stage and also emergency mental health access. We're now going to go on to Rebecca, who's going to talk about how we think that Keep Your Head can be improved. She's going to talk about the interactive map.
Hello, thank you. After viewing the Keep Your Head website, it was clear that there's a lot of very useful information that is precise and succinct. However, one issue is the layout of the text. It is written in large chunks of mostly one colour of writing and size. To improve this, the text could be put into a style of infographic that will allow young people to more clearly and quickly see what they're looking for, with plenty of images, colour and step-by-step guides that will steer them through how to help themselves or someone else. It would be a major improvement to websites for mental health services if an interactive map feature could be incorporated. This would be a large project as it would require professional development. However, we believe it would be worth the investment in effort and money because it will provide an accessible resource for young people looking for mental health support services appropriate to their location, age and type of mental health struggle. The interactive map would allow the person using it to filter by age, postcode and type of mental health support required. While we are still in lockdown, after everyone is vaccinated, people will have the opportunity to have face-to-face sessions again, which will also make this interactive map a long-term investment that would be beneficial during and after this pandemic. The map would direct them to a mental health service with its location highlighted on the map. When hovering the mouse over the service, it will detail the information about the service, such as opening hours, and also provide a link to the service's website. There could also potentially be a route drawn on the map, which gives time taken to travel to the hub, the mental health hub, when travelling by car, walking, taking the bus or cycling. It could also give travel information, for example, the ideal buses to take. This is an ideal feature that would improve accessibility of mental health services to young people, as many do not know where to find any services, let alone the ones that match their requirements.
Thank you, Rebecca. So our point there was whether or not you think that we could possibly develop this interactive map. Do you think that it would work? Do you think that these ideas that Rebecca presented are a possibility?
yeah, that's really helpful actually. And one of the things I completely agree with you about the big chunks of text. There's lots of information in there, but it's just really hard to digest. And I don't know about, you know, yourselves, but you sort of get through and you get halfway down and you're like, oh, you know, there's so much, you'd actually probably miss some of the point that is really helpful because there's just too much. I really like the idea of the interactive map. I like the idea of that sort of where you live as well, because there is variation across Cambridgeshire and Peterborough. And about by age, and in giving you kind of direction about where to go and on what your type of issue or concern might be. Again, I think we need to think about how we phrase some of that, so we're getting the right kind of words in there, so we're getting the, you know, so we're not using medical words when actually it might not be sort of everyday language that people think, actually this is, I'm feeling like this, therefore where do I go for help for this? So that's really helpful to hear that. And that's something we talked about, and that's why I brought it to the group. So we have a small project group that meets around Keep Your Head, and we're really keen to think about that. And one of the things we had talked about is how do we make it more interactive. I think what we need to do is go away and see what that means in terms of web design and how we can do that. But there's so many things that are out there that are interactive like that, and it's just quite text heavy. So I think it's really helpful to hear that, and I think it's something we can definitely take away. We have a web developer who has been doing some bits with us, so I think my task will be to go and find out, you know, how do we do that, what does that look like, what does that cost, what's the time scale around that. One of the things that I'd wondered around, so if you look at the website, you've got the text to clear some of the stuff down the side and actually make it so you can click on sort of shorter links, so it takes you to some bits, just to try and make what we have now a little bit easier. I don't know if that would help. At least then you could go, oh, I'm feeling quite anxious and whatever, and I'm clicking, you know, to make it just a little bit more interactive at the moment. So that's really helpful to hear, and it doesn't seem to me, it feels a really doable piece. If we just need to understand how we do it. So we don't have a technical team in the CCG who can do that, but I think it's definitely something we can feed in and look at, and it'd be good to kind of, if we've got some kind of concepts to bring them back and go, well, actually this is what we're looking at, is this the sort of thing you mean, to sort of keep checking in around that, because I'm very conscious, you know, obviously I'm here, but I won't be the person who's doing that, and been able to sort of link back with yourself to say, you said this, you know, is this the sort of thing you mean, are these the word, how can we do, and do some sort of prototype type things that we can look at and make it as useful.
That sounds really good, thank you.
Yeah.
Thank you, Rebecca and Catherine. We're now going to go on to Julia, who's going to talk about the current situation in issues of lack of education and waiting times. I think the lack of education also really ties in with this stigmatism.
So Rebecca, okay. I think there's a couple of questions that Rebecca just wanted to ask in terms of the website as well. Rebecca, are you okay to ask the questions?
Sure, yeah. The only question we could raise is when would this be, when could we establish these new changes for? When would it be doable, sort of? What would be a doable time frame for when we can make these changes?
I will need to go back to, so just to explain, so the website was set up by Public Health in the local authority, so they have the link with the web developer, so I'll need to go back to my colleague in Public Health to link up with the web developer to find out how long these things take, because I don't know, but I'll ask the question, I can come back to you and let you know, but I think it just depends on the web people's capacity, but I'll find out.
That sounds great, thank you.
As well, sorry, just staying on to the website briefly, could we possibly be like your guinea pigs, I guess, to feedback how this would work? So if in the future you manage the interactive map was able to work and up and running on the website, would we be able to, you know, give you feedback on how we think it works?
I think that would be really helpful,
Yeah.
particularly before
Sorry,
we put it out there to the wider public, to actually say, you know, this is what you've said, this is what we've put together. Is this what you meant? Is this right? I think that would be absolutely, yeah. That would be really beneficial, and then we can tweak it. So when we've got it, we make sure we have it in the right format and it does what it needs to do. And that's the main thing about the website. We need to make sure we can get the information out in the right way, in the most accessible way. So yeah, no.
Just, if I just could come in here as well and just say that amongst the alliances is ARU Peterborough and UCP. So you know we can also help design an app, you know, or help with a website if it's an issue like that we can support with. So within the alliance, there's know-how and intelligence of how to do that.
Thank you. That would be really, really helpful, because I did note on the agenda was sent, it was around an app, and that is something we've picked up and thought about, but actually we say it's, you know, it's understanding what the cost is around that and what that looks like, and actually how we can do it, you know, in the system. So any kind of support or advice or guidance that you've got that you think would be useful, but yeah, very welcome.
Sorry, may I ask one more? Oh, sorry.
You go for it,
Rebecca. Can I ask one more question? Thank you. We also wanted to ask, can we have a meeting with your web designer to sort of establish these changes and suggest things as a two-way relationship?
Yes, I say yes. Certainly, I'll have a conversation with my colleague in public health who's got the link with the web designer, and we can work out how that can work. And I can come back to you around that if that's okay.
Thank you.
Yeah.
Okay, thank you. So now we're going to go on to Julia, who's going to talk about the current situation to do with waiting times and lack of education. As I was saying before, I think the lack of education also ties in with the point about advertisement. So how can we make more people aware of these mental health issues that people face, and how can we help people find these sources of help that are available to them? So Julia?
So currently most people who need mental health support do not know where to go or who to contact without doing the research first. In a number of cases, the young people looking for this support are unsure of what they are experiencing. The struggles they are going through and are new and confusing. When you are unsure and confused about what you are going through, it is hard to find the confidence to do the research in fear of what you might find. The fear is only emphasized by the stigma surrounding the term mental health, discouraging young people to do the full research into finding the right type of mental health service that will benefit them. Nationally, 10% of children aged 5 to 16 are clinically diagnosed with mental health problems, but only 70% of that 10% actually get help. By 2021 in Cambridgeshire and Peterborough, undiagnosed mental health issues is predicted to increase by 10.3%. We need to make sure that the changes we aim to make will support this predicted increase in young people struggling with mental health, that it will educate the young people about mental health and support the people as well people as one of the main issues, the lack of education about this topic of mental health, as well as the issue Emma mentioned in her testimony about the long waiting times for getting any support needed.
Thank you, Julia. So now I'm going to talk specifically about the waiting list problem, about this idea of possibly the app Connect Peterborough, which I think we saw like an image of like a logo that I kind of came up with. Basically, the idea is that the issue is waiting times. So one of the ways we believe that this can be resolved is through another app. So the app would be called Connect Peterborough, and it would be used as an in-between stage after the initial assessment, but before their first session. So in order to access this app, young people would first have to have their initial assessment and be referred to it. But this is to make sure that people who access the app will benefit from it. So when referred to the app, the person who has taken the initial assessment will use either the young person's phone number or their email and create the account for them. And this is to make sure the young people stay safe and no one can use it for alternate purposes. The app will act as an anonymous chat room. So the young person who is struggling with their mental health will be assigned to a room with another young person who the doctor believes is compatible. When being referred, the young person can also talk to a specific gender or age, but both people involved in the chat will remain completely anonymous. While the young people wait for the professional help, they're able to anonymously talk to someone who's going through their similar struggles. I know that while I was waiting for my sessions, all I wanted was to be able to talk to someone who didn't know me and wouldn't judge me and also completely understood what I was going through. In some cases, this could be all the young person needs is just someone who understands and can help them understand their own struggles, even if they're not professional. I know that there are a few issues with it, so long as they don't treat it as if it's an actual session and that they just have a conversation about how they're feeling. But do you think that this is logistically possible? Do you think that we could maybe do something that people can use whilst they're waiting for their sessions?
So I definitely think that we need to think about how we support young people while they're waiting for services. I think that is an area that we need to look at. Whether we could develop an app like that, again, I think we'd need to look at. I mean, it sounds a brilliant idea. It sounds you put a lot of work into that, and I think we would need to have to look at the resource and what does that mean, and how, there's the initial setup as one thing, but also that ongoing and that sort of making sure that it's clinically safe. We'd need to look at and consider that, but I think certainly the principles around having somewhere for young people to check into while they're waiting for their support, and then I really like the idea that you talk about, actually this is for those who have been through that assessment, have been identified as needs, so it is those who are waiting and then have been identified as needs. That was really positive, but I think we would need to look at how would that work, who would oversee that. We just need to think about safety, as you've picked up, so there's resource implication, but also the clinical safety for those young people, so it's something we'd need to sort of think about, but certainly there is a conversations we've been having around how do we support people on the waiting list better, and this is definitely a positive thing. So I can feed that into a group that I sit on that's been having conversations, very very early days in terms of those conversations, and actually it's quite timely that you brought this. So I'm not saying we can do this, because I don't know the resource implications, but certainly we can think about how we can at the least think about some of those principles that you've talked about, how we support people on the waiting list. I think that's a real positive thing that we can do, and we can keep having these conversations about how we can work that through.
I know that there's this app, I'm trying to remember the name of it, and I can't remember who developed it, but there's an app that's supposed to be coming out soon about mental health, and it's kind of like a check-in app. It's basically kind of supposed to be just like a button that you can use with yourself and someone else, and you can basically just check in and like let the other person know that you're okay. And I think maybe like, even if we couldn't do the chat room, something just like that, where like someone could go into the app and just check in and just be like, how are you feeling today? What have you done today to make yourself feel better? Those kind of things. Helping people recognize what those triggers are that are making them feel worse, helping them recognize what's making them feel better. Just those first like few steps whilst they're waiting for their sessions. What do you think of that?
Yeah, and one of the things I've thought about, and again, I suppose it's a question for yourselves, is there are lots and lots of apps. There are lots of things that have come out nationally, and particularly in terms from COVID, there are lots of things that come out. And is it that we need to develop something new for Peterborough and Cambridgeshire, or is it that we just need to have somebody or some place that helps young people know about these, know how to access, know that they're there? Because I think there's lots of information out there. So do we need something specifically? So would it be helpful to have something specifically for Peterborough? So do we need to develop an app that gives us to local services, or is it about actually helping you navigate? There's lots of free apps that have already been developed, but actually do we know about it? And that, so that's sort of one of my thoughts that I've had about what is it that we need. So is it something we want specific for local services and that local support, or is it that we need just somebody to help you? If it's about having that anonymous check-in, does it matter if they live in Peterborough or if they live in Aberdeen, as long as it's safe and it's clinically, what is it that would be helpful? And I don't expect you all to have an answer now. It's some thoughts really about what is it that would be the most useful thing. because we don't want to reinvent the wheel, but we want you to be able to access stuff, because as you say, access is really important. But it's how we do that in the most effective way, I think.
Thank you. So we're now going to go on to Irini, who's going to talk again about Keep Your Head, but she's going to focus more on educating young people. So this is the issue about advertisement, how we can get this out to young people. So Irini, over to you.
Hi, yeah. So one way we think we can help young people understand the different types of mental health support and understand their own mental health is through education. There is already a large stigma around mental health, and often adolescents will think that they're not ill enough to seek help. We believe utilising posters and talks in schools can help spread the message about coping mechanisms, knowing what you're struggling with and recognising the signs if they or a friend are struggling with their mental health. Although a small step, it could have a large impact as more young people will feel comfortable in doing their own further research. Additionally, the more people talk about mental health and the more we advertise it, the more normalised it becomes, and the stigma around the term mental health will begin to change for the better. We could also consider advertising this on social media platforms, because this is where young people are likely to see the information that we need them to see. Largely too, as studies have shown that 72% of teens use at least one form of social media a day. Another way we could increase the understanding of mental health and find information about the different types of mental health struggles could be the app that Becky suggested. There's plenty of existing apps such as Me Too, Blue Ice and Calm Harm. However, we believe that with this app, we could even link it to the Keep Your Head website and include the interactive map, wait time chat forums, education and coping mechanisms, so that it's all in one easily accessible source. As a result, we believe more and more young people will be educated around the topic of mental health and feel more comfortable talking to peers and parents about what they are experiencing. This app being linked with the Keep Your Head website means that the information will be accessible in different formats, which some might prefer one format to the other. We hope that with your help, we can make this app a success and transform the stigma around mental health into something more accepted and normalised, so that each individual doesn't feel as though their problems are worth any less. We would just like to ask you how you think we could educate people with these services we already have and make them more accessible in any way.
So I think that's a really good question. How do we do it? So I guess my question almost back is around social media. So we, the CCG, we have social media platforms. However, I don't think we'd find many young people who are following Cambridge and Peterborough CCG on Twitter or Instagram, or maybe that's it. How do we engage that? Is it around schools, or I think that's probably something we do need to explore further about that, because we use we have CCG, we have our own social media platforms that we use, but would that be something that yourselves as young people would particularly link into? Possibly.
I think that one of the issues with social media is that there are a lot of social media. It's kind of similar to a point that someone made before about apps on your phone, because there's so much stigma around mental health. For those people who don't have those kind of issues, they have this idea of what it is. And so when you're following a social media account that's dedicated to mental health services, if one of your friends was to go onto your phone, if one of your friends was to go on your phone, as a lot of people do, if they were just trying to take selfies and spam your phone, but then find that on your phone and then make fun of you for it, I think that's the issue with going about it through social media. But if you were targeting young people specifically, I think what Irini said about going to schools and targeting them specifically with presentations and just talking to them, I think that's probably a better way about going to educating them rather than social media, because at least that way, those people who don't understand it very well, who don't have those kind of issues, they're still there, they're learning about it as well, even if they can't relate to it on the same kind of level.
I think a lot of people also follow schools' social media. So if schools were to post about mental health or how to get help, people might find that more accessible than a dedicated account or an app.
Or even, I think, if people came in and did workshops
as well,
because workshops could be a good way of involving students and kind of educating them all at the same time.
but I think it's how we do those workshops. Like, would the CCG be willing to send over staff, because staff at schools aren't educated in how to deal with these kind of situations, on how to give the right education to these young people. So would the CCG be willing to send over staff to help with this?
So in the CCG, we commission an emotional wellbeing service, and their role is to work with schools to help schools think about, but they are quite a small team, and we have a very big, as I said, we've got a big geography across Cambridgeshire and Peterborough. And I think there does need to be, so there is that provision. In terms of doing workshops and assemblies with schools, I think there are pieces of work that are going on, but I think it's a little bit depending on the school you're in. So I think it's something we need to think about how we do that better. One of the things I'd thought about was around, and again, it's a question for your thoughts really, around sort of what we call peer support. So young people who have experienced mental health issues going and speaking to other young people about that, and how that would that be received better, or does it need to come from professionals? It's understanding who that information comes from. And again, it's also pitching it at the right level. So it's having sort of general information and knowing where to go, and these are all, these are your services.
Could I suggest, oh, sorry.
Yeah, no, carry on.
I was going to ask, could I suggest that if there's a problem with staff, that maybe there's like an online series that you could make about informing and educating teachers? If there's a problem about getting the teachers to teach people in the school, could you perhaps think about putting together like an online course that teachers can access and kind of understand a bit better that way, rather than you having to send someone to every single school? You could send the video out to every single school.
And there's certainly, and that's certainly, I think, one of the things that have come out of COVID, and the fact that we're all working now very much more digitally than we were before. There has been a lot of work gone on into schools around information being shared, and there's been a national, it's through the Department of Education, the Wellbeing Return, and that's about providing kind of training and information and sharing forums for school staff to think about mental health in their schools and how to prepare. I think one of the challenges at the moment is around knowing what the impact of COVID is going to have, and how's that going to feel, and that's quite individual to different schools. But certainly what has been positive is now we are working digitally, more people are able to access, schools aren't having to release staff to travel potentially 30 miles to go to a meeting to have that conversation. So it's definitely, there is work going on, but I think we've still got a way to go. But there is lots of work going on with the local authority and their remit around schools, and ourselves at the CCG linking in with them as well around having training and helping schools think about mental health and well-being and how they can do that.
Thank you.
Thank you. So we're coming close to the end of our meeting now. So I'm just going to really quickly recap on the ideas that we presented with you today. So we talked about an emergency phone number for those who need help, whether it's, an emergency or just in general, if they just need someone to talk to in that moment. How we can improve the initial assessment stage to make it feel less patronising and more comfortable for people to go through. How we can improve Keep Your Head, so both the interactive map as well as educating young people, and then also the waiting list. So what can we do to make sure that people don't feel like they have no support during this time whilst they're waiting for sessions? And now I'd like to have a discussion with everyone to decide on 2 of those issues that we're going to focus on with you, Catherine, before our next meeting. So what kind of 2 issues stand out most to you?
To me or to everybody?
I think I just everyone.
Yeah.
We'll start with you, Catherine.
So I think for me, the Keep Your Head and doing that interactive map and how we get that information out there, because I think as you'd noticed, there's lots of information, but it's just not very user friendly, and that feels something that we can definitely progress. and we can look at and we can do. I think I wouldn't say the emergency number, because there is the NHS 111 option too, but maybe it's a point about making sure that that is adequately advertised and promoted amongst schools and for young people as well, because I don't know, but my thought is maybe that's sort of been focused towards adults, and therefore we need to do that. And so I think the support on the waiting list is really important and a really useful point to think about how we do that better. But I'm very open to look at whichever two.
Thank you. So we did have a discussion briefly before we came into this meeting. It was very split. A lot of people, had different opinions. I think if I'm going back to the points, I think the two that we decided on, oh, and I've lost it. I think that the two that we decided on, if I'm remembering correctly, it was between, I think, the initial assessment, the map, and the waiting list. This is to everyone. Is that right? Does that look about right?
That sounds about right.
Yeah. So if you think the interactive map and the waiting list are something that you would like to work on with us, then I think that's brilliant. I think that we've got our two main focuses that we're going to look at on how we can better the access to mental health. We would like to have another meeting with you in a month's time, so on Wednesday the 24th of March at 3 o'clock. How does that sound for you?
24th of March. Yeah, I can do that. That's fine. That'd be good.
Yeah.
Yep.
Brilliant. So that's Wednesday the 24th of March at 3 o'clock. We'll see you at 3 o'clock. Is that? Yeah.
Yeah.
So we'll see you then. And between then now, we're going to focus on the interactive map. We'll look back at the website and come up with some ideas on what we think that we can improve on it. And we'll also have a discussion about the waiting list app and talk about what we think. But we'd also love to hear from you about, what your colleagues think about these ideas as well from the next meeting.
Yep, certainly. And
I think,
and I will go away and find out about timescales around the app. I know the conversation that Rebecca raised about could we meet the developer. So I will go away and find out about that process and what that means and how we can do that. So yeah.
Thank you. I think that's pretty much it for today's meeting. So thank you, Catherine, for joining us, and thank you everyone for your lovely testimonies and everything that you had to say and all your brilliant ideas. We're going to conclude now with a evaluation from Dilraj or Tim, I think. Yes. Yeah.
Great. Thank you, Becky, for chairing that, and the team. Catherine, I'd love to hear your feedback. How did you feel the young people did with this meeting?
When I first met you all last month, I found it all very inspirational. And again, the thoughts you've come up with and, the questions and the challenge, I think it's absolutely right. And and I welcome that, because actually we won't make improvements unless people question and challenge. And actually it's very solution focused. It's very much about, okay, so well, these are the issues, but actually this is what we think we can do around that. And I just think it's a really positive way of thinking and moving and making change. So yeah.
And how are you feeling, Catherine? How are you feeling about it?
I'm feeling really excited. I'm still feeling excited. I think it's, I really hope that I really want us to be able to make some of these changes. There will be restraints around resource, which we all have challenge around that. But actually, I think some of the points about getting the information and how do you support people, it doesn't seem unrealistic and undoable. If that's a word, I'm not sure that's a word at all. Yeah. So yeah, really excited.
And I think we just had another question as well, because mental health has come up on a citywide level, and especially for adults as well. Mental health. There's been a couple of testimonies where there's been quite big failures in having support for mental health, like within A&E, for example. And we would love if you could set up a meeting with whoever who's in charge of within the CCG for the adult mental health side of it. So is that something you could set up a meeting for?
Yeah, I can get you the contact details for the people to speak to at the CCG for adult mental health. Yeah, that's not a problem.
Great, fantastic. Thank you so much. James?
Just to build on what you're saying from another meeting that we've had, are there any areas, either CCGs or areas in the country that you know have really good practice for mental health, or you could direct the students to look at to get some ideas and inspiration?
Yes, there are lots of different places that do different things better than we do. I suppose it's just, I'll have to go away. If I focus on those 2 key points, because actually, you know, it's huge. So there are some places that do very acute care very well, some that do very early intervention. So would it be helpful if I look at those 2 areas and find some areas that are focused on them too? So they're kind of their information, and then how they're supporting people on the waiting list. If I look at them and then I can direct that, would that be helpful? Just so we're not trying to, because it's just such a huge remit, it's around how we focus down. Would that be helpful? Yeah, I can do that.
We should let Catherine go. We've already booked her diary for an hour. Catherine, it's thank you so much. I think you know, from around the room, it's just a pleasure to work with you, and I think we're all excited really about what's possible.
And if anyone's got any questions in the meantime before we meet again, then please do feel free to contact me.
Okay.
Absolutely fine.
I definitely will, Catherine, so I'll be in touch.
Brilliant. Okay then, thanks everybody.
Thank
Have a good
you.
afternoon.
You too. Bye.
Thank you.